quickly on Pharma. So you remember the piece that you remember the executive order that Trump signed that basically requires pharmaceutical companies to sell drugs to Medicare in the United States, the largest buyer of drugs in the U.S., at the lowest global price. At the lowest global price, right? And that's going to go into effect here. I mean, as we talked about it at that time, this is going to destroy R&D. It's going to destroy, innovation. It's going to destroy investment in new drugs. It's going to make it impossible for drug companies to make enough profits to justify the investment in these new drugs unless they stop selling drugs to a lot of very poor countries and therefore don't give discounts to anybody and force drug prices to be much higher everywhere else in the world and create competition from drug companies that overseas that don't pay attention to IP. And it's just going to create a disaster. And one of the disasters that the Wall Street Journal points out, again, a good editorial in the Wall Street Journal by Richard Burr, is that one of the things that's going to happen is that another country's drug industry is, which is already competing strongly with the United States, is going to overtake us in terms of the design, the production, the testing, and the approval of new drugs. And that is China. Here's what the op-ed says. Meanwhile, China isn't catching up. It's surging ahead. In 2024, Chinese companies launched more clinical trials than U.S. firms. Analysts expect 37% of new licensed compounds this year will come from China. Once known for copying Western drugs, Chinese companies are now developing their own, especially in areas like oncology and immunology. At the same time, European countries with price controls have seen an exodus of clinical trials and lost their leadership in drug development. Right? So this could mean, he goes on, China could control which types of new pharmaceuticals are developed and who has access, including targeting drug development for large populations that have financial benefits and leaving drugs that treat rare diseases out of the equation, which is likely what they will do. Currently, 68% of new drugs are approved first in the U.S. If China overtakes our leadership, we're in danger of losing this edge, leaving American patients to wait for China to decide when we can access new medicine. China politicizes everything, although we'll talk in a minute about maybe potentially some good news out of China. Here's what he ends the piece on. We face a choice. Adopt Europe's failing price controls and bureaucratic health system while watching China gain ground, or stand up for American innovation. Hold our allies accountable, that is, that they need to pay more for their own drugs, and protect the free market engine that powers the next generation of medical breakthroughs. The Chinese are betting we'll choose poorly. Let's prove them wrong. So, again, a good, the Wall Street Journal has some good editorials. That is a good editorial pointing out more really, really, really bad policies coming out of the Trump administration. So it's just, let's not get too excited about dropping 14 bombs on Iran and then calling a ceasefire when all the economic policies and all the policies related to business are really horrific, really disastrous.